You may have heard hundreds of times that high cholesterol, high blood pressure, or high blood fats are the #1 culprits behind heart attacks and strokes. But today, I want to share with you a shocking truth. That silent culprit is not necessarily in your heart, nor in your blood vessels. It's right inside your mouth. Hard to believe, isn't it? A tooth that had a root canal many years ago, or a small infection at the base of a tooth that causes no pain and shows no symptoms at all, could actually be a ticking time bomb threatening your brain and your heart. I'm not saying this based on theory alone. I myself nearly paid a heavy price for overlooking this problem. Not long ago, I went in for a routine dental checkup. That time, they used a new technology, cone beam 3D CT scanning, a machine that can see deep down to the tooth roots and detect things regular X-rays often miss. When I saw the results, I was truly shocked. There was a dark ring clearly visible around the root of a tooth that had undergone a root canal years earlier. The dentist told me, "This is an infection, an abscess that's eating away at your bone." And the frightening part was, I had absolutely no symptoms, no pain, no swelling, no sensitivity. I thought I was a rare case, but when I shared this story, I realized countless others had gone through something similar. They suffered from long-term fatigue, arthritis, poor memory, even heart problems, without ever finding the cause. Until, during a dental exam, the dentist discovered an infection that had been quietly lingering in their jaw for years. Recent medical studies have revealed a terrifying secret. In blood clots taken from patients with strokes and heart attacks, scientists found DNA from bacteria originating in root canal-treated teeth. In other words, bacteria that seemed confined to the mouth can travel throughout the body, invade blood vessels, and even reach the heart and brain. And when these invaders combine with chronic inflammation, they trigger blood clot formation. It is these very clots that act as the direct detonator for heart attacks and strokes. What chills me the most is this. Millions of Americans every year undergo root canal treatment. Yet most of them, along with their doctors, have no idea that the hidden danger inside that tooth could be an even greater threat than cholesterol or high blood pressure. Today, we're going to uncover this truth together. I'll show you why a small infection at the base of a tooth can impact both your brain and your heart, the vague symptoms you may have overlooked, and most importantly, how to recognize, prevent, and address the problem to protect yourself. Because the reality is, you can take blood pressure medication, exercise regularly, eat a strict diet, but if you're still carrying a hidden infection in your mouth, the risk of heart attack and stroke is always lurking. So are you ready to discover the #1 culprit that no one has ever told you about? If the introduction surprised you, then here comes the real smoking gun, the undeniable evidence. In many medical studies, scientists have analyzed arterial plaque and even the blood clots that block the heart and brain in patients. The results are almost unbelievable. They found DNA from bacteria originating in root canal-treated teeth. At first, it sounds impossible. Teeth are in the mouth, while the heart and brain are far away. So how can bacteria from a single tooth march all the way to these vital organs? The answer lies in nature's incredibly intricate design. Each tooth is made up of thousands of microscopic channels called dentinal tubules. No matter how carefully a dentist cleans during a root canal, eliminating 100% of the bacteria inside those tiny tubules is virtually impossible. And when the tooth pulp is removed, part of the local immune defense disappears with it. This unintentionally turns the root canal-treated tooth into a safe haven for bacteria, allowing them to survive stubbornly for years.
Every time you chew, the pressure on that tooth can push a small amount of bacteria or their toxins deeper into the lymphatic system, then spread through the bloodstream to the entire body. Once they enter circulation, their destination could be anywhere: the knees, liver, kidneys, heart, or even the brain. One of the most commonly documented conditions is chronic apical periodontitis, an infection that silently lingers at the root of a tooth that has undergone a root canal.
The frightening part is that it often causes no pain, no swelling, so most people have no idea they're carrying a biological time bomb in their jaw. And the consequences? These bacteria activate the immune system, triggering systemic inflammation. Long-term chronic inflammation leads to an imbalance between free radicals and antioxidants, a state called oxidative stress. When the body is stuck in this constant inflammatory state, a natural reaction occurs: the formation of blood clots. And it is these very clots that become the direct agents of heart attacks and strokes. One published study revealed that among more than 100 patients with heart attacks and blocked coronary arteries, a significant percentage had bacterial DNA from root canal-treated teeth found right inside their clots. And not just in the heart. In stroke patients, scientists also discovered the very same bacteria in the blocked blood vessels of the brain. This means the connection between teeth and heart, between mouth and brain, is no longer just a theory, it's a proven fact. And here's the key point. You can manage your cholesterol, you can take blood pressure medication, but if you carry a chronic dental infection, the danger is still there, silent and deadly. In the next part, we'll dig deeper into the mechanism of these invisible invaders, how a small infection can cause devastating consequences for the entire body. First, let's take a closer look at a condition known as chronic apical periodontitis. This is a persistent infection that forms near the tip of a tooth's root, usually after a root canal procedure. The root canal removes diseased pulp, but the treatment can never fully sterilize the area. Tiny colonies of bacteria remain, hiding deep inside microscopic dentinal tubules, almost like soldiers retreating into hidden tunnels. Once there, they can survive for years without being detected. Every time you chew, the pressure on that tooth acts like a miniature pump. With each bite, bacteria and their toxic byproducts are pushed out of the root tip and into the surrounding lymphatic system in the jawbone. From there, they quietly slip into the bloodstream, hitching a ride to distant organs such as the knees, liver, kidneys, heart, and even the brain. Unlike a sudden acute infection that overwhelms the body, this process works silently and persistently. The bacteria create a low-grade chronic inflammation. In response, the body continually produces inflammatory cytokines. Over time, this sparks oxidative stress, a state where damaging free radicals overwhelm the body's natural antioxidant defenses. This combination is extremely dangerous. Chronic inflammation weakens blood vessel walls, making them fragile. Oxidative stress makes the blood itself more prone to forming small clots. When one of these clots travels, the consequences can be devastating. If it blocks a coronary artery, the result is a heart attack. If it lodges in a brain artery, it causes a stroke. The truly frightening part is that this process develops in silence. You don't feel the usual warnings we often associate with infection. No sharp pain, no swelling, no throbbing toothache that forces you to call a dentist. Inside your mouth, everything seems fine. Yet beneath the surface, something far more dangerous is taking shape. While your mouth feels quiet, the rest of your body starts sending subtle distress signals. You may notice fatigue that never seems to go away, mysterious joint pain, stiffness that feels like arthritis, or even a persistent mental fog that makes concentration difficult. For some people, this hidden infection doesn't just sap energy, it can ultimately lead to a sudden heart attack or stroke. In other words, what looks like a harmless, silent dental issue may in fact be the hidden spark for life-threatening conditions throughout the body. To understand this better, imagine your body as a house. An infected tooth after a root canal is like a termite nest tucked away under the floorboards. You don't see it, you don't hear it, but day after day, those termites keep gnawing away at the foundation. Everything appears stable on the surface until one day the floor collapses without warning. By then, it's far too late to patch it up. That's exactly how a hidden dental infection can silently erode your health until a crisis strikes. This is why it's so important to pay attention to the subtle symptoms that are easy to dismiss. The greatest danger of infections around root canal-treated teeth is not that they hurt, it's that they don't. You can live for years, even decades, without realizing a bacterial colony has taken hold inside your jawbone. But your body is never completely silent. It keeps sending small signals, whispers that something isn't right. Unfortunately, these whispers are often misinterpreted as normal aging. Take persistent fatigue, for example. Many people over 60 believe that feeling tired is simply part of getting older. But if you are sleeping well, eating reasonably, and still waking up drained day after day, your body may be engaged in a constant internal battle against chronic inflammation, triggered by hidden bacteria. Or consider joint pain and arthritis-like symptoms. When bacteria travel from infected teeth through the bloodstream, they can lodge in your joints, sparking inflammation. The result is stiffness and aching that no doctor can fully explain, often labeled simply as wear and tear. But the real trigger could be microbial invaders from your mouth. Then there's brain fog, a troubling sense that your memory is slipping, your concentration fading, and your thoughts are clouded. Instead of automatically blaming age, it's worth asking whether ongoing inflammation is interfering with your brain and nervous system. Finally, there are unexplained cardiovascular symptoms. Irregular heartbeats, sudden palpitations, or fluctuating blood pressure may not just be bad luck or anxiety. They could be your body's warning signs of systemic inflammation rooted in a dental infection. What makes this so dangerous is not just the hidden nature of the infection, but our tendency to overlook these symptoms. By learning to recognize them, you gain the power to act early, before that silent termite nest collapses the floor. The sad truth is, many people who go for a general checkup are often told, it's just aging, or it's stress, or it's lack of sleep, and so they continue living with those vague symptoms until one day a real crisis strikes. Remember this, the body always whispers before it screams. A small infection in the mouth can send signals throughout the body in the form of very ordinary symptoms. If you pay attention and act early, you can prevent a future heart attack or stroke. Now, let's talk about a familiar but powerful ally in the fight against chronic inflammation: liposomal vitamin C. It's not a miracle cure, but it is a tool that helps the body defend itself against the oxidative stress left behind by bacteria. Earlier, we saw how a silent dental infection can spread, causing fatigue, joint pain, and even affecting the heart and brain. But what exactly is happening inside the body when this condition persists? The answer is oxidative stress. Picture your body as a city. Your cells are the houses, and free radicals are tiny sparks. If there are only a few sparks, the city is fine because it has a fire department, your antioxidants. But when fires break out all over the city at once and the fire department is too small, the city eventually burns down. That is oxidative stress. Too many free radicals, too few antioxidants to put out the flames.
When an infected tooth continuously releases bacteria and toxins into the bloodstream, the body responds by producing large amounts of free radicals to fight them. Over time, however,
the excess free radicals begin damaging healthy cells as well. The result is injured blood vessels, weakened vessel walls, and a body more prone to forming clots, the direct bridge to heart attacks and strokes. So what can we do to support the body in this battle? One answer is vitamin C, especially in its liposomal form. Unlike regular vitamin C, liposomal vitamin C is encapsulated in tiny lipid bubbles, allowing it to penetrate cells more effectively and cause less digestive upset. This is why it's considered a powerful weapon against oxidative stress. Experts suggest a daily dose of about 1 to 2 grams divided into smaller portions, for example 500 milligrams at a time. Because vitamin C is water-soluble, splitting the dosage helps maintain stable levels in the bloodstream throughout the day. An added benefit, the liposomal form is less likely to cause diarrhea even at higher doses. However, it's important to emphasize, vitamin C is not a cure for dental infections. It is simply a supportive tool helping reduce oxidative stress, boosting the immune system, and making your body more resilient while you address the real root cause. Many people who started supplementing with liposomal vitamin C have shared that they feel less fatigued, experience less pain, and enjoy clearer thinking. If you notice these kinds of improvements, take them as signals to look deeper. Recheck your dental health, review your diet, your sleep quality, or even investigate other hidden sources of infection in your body. Think of vitamin C as temporary armor. It helps you endure the storm of arrows from bacteria while you work on diffusing the balm at its root. Next, we come to a more difficult crossroads. If a root canal-treated tooth becomes infected, should you keep it or have it extracted? This is never an easy decision, and it requires careful discussion with your dentist. The problem lies in the tooth's incredibly complex structure. A single tooth contains thousands of microscopic dentinal tubules. During a root canal, no matter how skilled the dentist, completely eliminating bacteria from these tiny channels is nearly impossible. Even when the tooth is sealed and looks fine, bacteria can still survive inside and quietly fuel infection. So what happens if you keep the tooth? If the infection persists, your body may endure chronic inflammation for years. These bacteria don't just stay confined to the mouth, they continuously leak into the bloodstream, fueling oxidative stress and raising the risk of heart disease and stroke. Many patients have shared that after removing such a dead tooth, their health noticeably improved. Less fatigue, reduced pain, and even more stable blood pressure and heart rhythm. We should consider extraction when a root canal-treated tooth continues to ache, when infection keeps coming back, when a cone beam CT scan shows an abscess or infection around the root, or when you're experiencing unexplained systemic symptoms such as fatigue, arthritis, or brain fog, and your doctor suspects the tooth may be the culprit. Of course, extraction is never a light decision. After removing the tooth, you'll need to think about a replacement option. Options after extraction. Dental implant. Pros: aesthetic, durable, and functions like a natural tooth. Cons: expensive and requires a strong, healthy jawbone. Tip: for sensitive individuals, zirconia or bioceramic implants may be more compatible than traditional titanium. Dental bridge. Pros: faster process, moderate cost. Cons: requires shaving down the two healthy neighboring teeth to serve as anchors, which weakens them over time. Removable dentures. Pros: most affordable, non-invasive to adjacent teeth. Cons: less convenient for eating, requires diligent cleaning, and less aesthetic compared to other options. Each choice carries its own costs, both financially and for your health. That's why it's best to have a thorough discussion with your dentist, especially with a holistic dentist who understands the deep connection between oral health and overall health. Another major obstacle is the cost of dental care. In the U.S., dentistry is often separated from the general healthcare system, and many insurance plans don't cover it, leaving countless people unable to access necessary treatment.
This is an issue that needs systemic change, but until that happens, you can still take action by researching thoroughly, seeking a second opinion before deciding on a root canal or extraction, and choosing a reputable dental clinic that uses modern technology like cone beam CT for accurate diagnosis. The decision to keep or remove a tooth is not just a dental matter, it's a decision that can affect your heart and brain. Don't take it lightly. After hearing about the hidden risks from root canal-treated teeth, you may be wondering, so what can I do to avoid ending up in that situation? The good news is you can absolutely build a defense system for your heart and brain health, starting with your toothbrush each day. Practice proper oral hygiene. Brush your teeth at least twice daily, once in the morning after waking up and once at night before bed. Use dental floss to clean between your teeth where the brush can't reach. Consider a gentle antibacterial mouthwash to help reduce bacteria in the mouth. A heart and tooth-friendly diet. Limit refined sugar, sodas, and processed foods, the favorite fuel of inflammation-causing bacteria. Increase your intake of leafy greens, fresh fruits, nuts, and antioxidant-rich foods. These are your allies in reducing systemic inflammation. Add foods rich in vitamin D, calcium, and omega-3s to support bones, teeth, and cardiovascular health.
Routine dental checkups. Don't wait until you're in pain to see the dentist. A checkup every 6 months helps detect hidden infections early. If you've had a root canal in the past, ask your dentist about a cone beam CT when necessary. This advanced technology can reveal infections that ordinary X-rays often miss. Be cautious when advised to get a root canal. If your dentist recommends one, take time to research and consider seeking a second opinion. Choose a clinic with experience, modern equipment, and an understanding of the connection between oral health and overall health. Maintain a healthy lifestyle. Get enough sleep, stay active, and manage stress. Remember, your mouth is not separate from your body. If you think brushing is just for a pretty smile, you're overlooking the truth that every healthy tooth is a shield protecting your heart and brain. We've just taken an eye-opening journey together, from a tooth that seems harmless all the way to the risk of heart attack and stroke, two of the leading causes of death for people over 60. What I want you to remember most is this: your heart and brain can be threatened by silent infections in your mouth. The cause isn't always cholesterol, blood pressure, or blood fats. Sometimes the root lies in a tooth that had a root canal years ago. I know that hearing this may make some people feel anxious, but the good news is you are not powerless. On the contrary, you can actively protect yourself with very specific steps, such as taking liposomal vitamin C to help fight oxidative stress, getting regular dental checkups, especially if you've had a root canal, maintaining good oral hygiene and a healthy diet, and consulting your doctor promptly when unusual symptoms appear. Don't delay. Maybe you've experienced unexplained fatigue, joint pain, or a fading memory. Don't rush to blame it all on aging. Instead, see these as signals from your body urging you to dig deeper, perhaps starting with your teeth and gums. Let me repeat. The information shared in this video is for educational purposes only. It does not replace professional medical diagnosis or treatment. Always consult a qualified doctor or dentist before making any decision related to your health. Share your story or experience in the comments below. Your journey might just be the key that helps someone else avoid a heart attack or stroke. If you found this video helpful, please click like, subscribe, and share it with your loved ones. A single click today could save a life tomorrow. And finally, please remember this. A healthy smile is not just about appearance. It's a sign of a strong heart and a sharp mind. Care for your teeth as you would care for your life itself.
Because sometimes the difference between living independently in peace and facing a sudden health crisis comes down to a single tooth. Thank you for staying with me until the very end. Take care of your health, protect your smile, and cherish every heartbeat.